We all want our doctors to be confident and competent in treating us. We want them to be able to recognize our conditions and explain them in a way that is easy to understand. We want to have the best care possible. But what if you had a barrier to that care? Some populations, such as those with an intellectual disability, face more barriers to healthcare than others. Approximately 6.5 million people in the United States have an intellectual disability. All healthcare practitioners will work with patients with intellectual disabilities, yet there is no specific requirement for medical schools to teach future doctors on how to care for and communicate with this population. Given the prevalence, it is vital that we have the community resources and provider training to give people with intellectual disabilities the care they deserve. Lack of understanding can lead to poor attitudes and communication from healthcare providers. This can cause misdiagnosis, unsuitable treatment, inappropriate medication prescribing, and inadequate healthcare. One way to address these barriers is to start teaching clinicians early through experiences such as MedFest volunteering with Special Olympics, where athletes receive free sports physicals. This would give future doctors more confidence and prevent later uncertainty in medical practices. Making this a standard part of the curriculum would be instrumental in improving care. My goal in this project was to determine some of the barriers to care for individuals with intellectual disabilities and gauge the perceived value of an education implementation into the medical school curriculum. I surveyed parents and guardians of Special Olympics Wisconsin athletes as well as clinicians to get their perspective on barriers to care and what they think would be valuable in educating medical students. Community members that I spoke with found this to be an important topic and were enthusiastic about helping. Some areas that people found would be helpful to focus on in the medical school education included communication tips, community and healthcare resources, and clinical screening timelines. One quote gathered from the survey was, "Medical students should have at least a little experience working with disabled people before they become doctors." I completely agree, and I hope to make a change to ensure that medical students have a higher level of confidence going into their fields and caring for this population.
Created using Powtoon.